It's my pleasure to be here, and as a little history, I want to take you back to my clinic at the Durham VA Medical Center in 1997. A couple patients came to me having done this strange diet. They fixed their weight problem, and I didn't do anything, except I was curious. I followed my theme is I listened. And I didn't know that was unusual for a doctor. So I listened, and it's really my pleasure to present to you the first time ever this presentation. And there's also something called timing is everything. I think the timing is right to put everything that you've seen here into action. I think the timing, so I've listened to you on the low carb cruise. I've listened to you, my patients who come to see me in Durham. It's great to see you all. I listened to Jackie Eberstein, who is now with me on this business idea and business venture. And so let me present to you findings that we see every day at the Duke Clinic, the Duke Lifestyle Medicine Clinic, and then the grand scheme of how we can actually scale this up and make a big impact to people, not only in the US, but also around the world. So, hang on. We all know obesity is bad. I'm gonna go through my slides a little faster than Dr. Runyon. What's pretty shocking is most patients want to lose weight, and there are an average of 4 weight loss attempts per year, and almost all of them fail. Because of what you just heard, we've been using the wrong tool, generally. We, meaning the medical profession. The doctor in the training, it's estimated, has a maximum, really, of 10 hours of training in nutrition. I think that's even less now than before. I got very little training 25 years ago, and today I can't even get into medical school to give a lecture on obesity or diabetes. It's just chock full of other things. So we have to do something ourselves. So over the last year, we've been working hard to create a business called Heal Medical and Weight Loss Clinics. Heal Diabetes and Medical Weight Loss Clinics. Heal meaning healthier eating and living. And the 3 components behind Heal are the clinic model, seeing patients one-on-one. As you just heard from Dr. Runyon, if you're on insulin, if you're on medications, you need to have a practitioner who understands the impact of those medications and how you get off them. Also, the food availability is important. So this business will also have access, will resell or create foods that are truly low in carbohydrates and full of healthy foods, not random products and additives and all these sugar, alcohol kinds of things. So the other third thing that's really important is the behavioral support over time, which may be in the form of coaching, one-on-one, but also remotely as well. So these are the 3 components for Heal, and the actual implementation of it is going to be with a health assessment. It's kind of like seeing your regular doctor, basically, and you, having the support over time, but the focus and implementation will be the low carbohydrate diet, which I'm using at Duke. And I just wanted to show proof that it works. This is Janet pre and post photos, but also her hemoglobin A1C, which was in the red zone, meaning diabetic range. And here's what she told me. She said, I had diabetes for 10 years and was taking medications. My doctor told me that I needed to take insulin. I searched for another answer. I didn't want to have to take medication. I didn't want to have diabetes at all. And so the diabetes was cured by the low carbohydrate diet. And here's her hemoglobin A1C of over 5.7 is one of the definitions of diabetes. And so she went from being on medication and having diabetes to having no diabetes and no longer taking 2 diabetes medicines, had diabetes for 10 years. This slide shows the number of units of insulin on the y-axis. So this person was on 100 units of insulin on the first day that I put them on a low carbohydrate or HEAL protocol. And over a 2-week period, this person came off all 100 units of insulin. So this is the reality of what happens, of it, the theory that you just heard Dr. Runyon talk about. So this happens every day. Put people on a low-carb ketogenic diet or a HEAL diet, and you can get this person off 100 units. If you can see the details, those are the minimum and maximum blood sugars in milligrams per deciliter, and then the weight loss. It didn't take much weight loss to get this person off insulin. I had to reduce the insulin by 50% on the first day because they no longer need it. And if they were on the same amount of insulin, their blood sugars would go too low. This is another patient, so each slide here represents a patient. I count up all the number of units of insulin. This person was on 80 units, was off 80 units of insulin in 1 week. So this isn't lightning striking once or twice, okay? It's predictable. 60 units of insulin off in a week. Blood sugars are better than before. 100 units of insulin. Doesn't matter how frequently. This is the note at the bottom is 15 units short-acting 3 times a day, 60 units long-acting, reduced to 60 units long-acting, 40 units long-acting, 0 units. Blood sugars are better than before. Remember what's happening. The treatment here is taking away the carbohydrate from the food. That's it. No pills, no products, just taking away the carbohydrates. My world record, 180 units in 1 day. In retrospect, guess what this person was drinking? Sugar-sweetened soda. Why a doctor didn't just think of, well, what are you drinking, sir? Or, anyway, it was pretty impressive. 160 units, this is just different. 250, 280 maximum unit now. This person was on 500 units of insulin. He's not quite off yet, but he's almost off. But can you imagine, he's saving so much money not buying this insulin. That just makes him happy, tickled. He and his wife come in, and they both are losing weight. It's a lot of overlap between couples and family because all we're doing is changing the food. It's pretty amazing. Lynn Ivy, who you've probably all met on the cruise, she's on this cruise as well. Her story is that she has lost from 370 to 140 pounds after taking away carbohydrate, and she's been very generous to share her story on blogs and websites and all. And many of you have done that as well. So the business model for HEAL is in great detail, and we have a booth here actually on the cruise that we're going to have someone manning all the time. And if you want all the details, you'll get the details, which include a clinic within a clinic model. So this has been done before with the lifestyle program where we don't own the clinic. What we do is we go in and we rent the space of another doctor, for example, a cardiologist or OBGYN doctor who wants this for their patients. The brilliance of that is we don't have to advertise. So we go in, and in fact, the cardiologist who I'm working with now to get the first clinic says, we're going to send all of our staff first. They need your approach, and then it will send all of our patients as well. The spillover is we bring in HEAL patients for lifestyle if they don't have a cardiologist or they need fertility or OBGYN, then we refer to that host doctor. And over time, what happened after a year or two is that the HEAL clinic will probably bring in as many patients. Well, the host clinic will make money off the people that the HEAL clinic brings in. So we've worked pretty hard over the last year to come up with this model, and getting the first clinic going in Durham. It has happened over the last 3 months, and we're working to finalize that. So why I'm bringing this up, and it's the opportunity, I'm crediting you all, because every time I come on the cruise and my patients coming in and our support group locally, they say, what can we do? What can we do? How can we help? Well, you can help HEAL. Okay, so it's an effort. It's a business. It's stock sales and all that. It's out of my realm. So I have a business partner who does all that. We have it all explained, and the details are like on this slide: forecasts and amount and use and business exits and all that. People say you really, in a startup company like this, you're really selling the people, and so I've been involved for about 18 years now. I can't believe it. Starting really kind of the renaissance or re-examination of the low-carb diets with modern techniques, and there had been a 20-year lack of data, and we were one of the first groups to publish that. With Jeff Volek also did it about the same time. But Jeff is a PhD, not an MD, and so I have to do this. I mean, it's the people have told me, look, you're the one, you're the guy, you're in that position, and so now I'm asking you if you want to get involved. Now's the time, and we have a team that is unparalleled. So who would you get? You get Jackie Eberstein, who worked with Dr. Atkins for 30 years. Jackie's part of the team. And you get Dana Carpenter, who's at the booth at the moment. Thank you, Dana, for waving. And we have an executive summaries to show all this. And but you know, the first investor, Ramona, could you stand up a second? It's like I'm channeling, the enthusiasm of people like Ramona, who kept saying, we need to do something, and so I'm giving you this summary really for the first time in a large public forum, and I really thank you for the opportunity.